Welcome back. I'm Dr. Farber.
I'm Dr. Shah.
Today we're going to talk about breast lifts or mastopexy. So what is a mastopexy or breast lift? So basically what it is a surgery that reduces ptosis or droopiness of the breast. So with age or after childbearing, you may have droopy breasts. So what a breast lift does is restore the position of your breasts and your areola and nipple back to a more youthful position on your chest.
You may be wondering if you're a good candidate for a breast lift, and it's the usual things with surgery. You should be in good health. You should not be smoking. The incisions for a mastopexy, it involves a lot of incisions on your breast. So if you are smoking, vaping, anything with nicotine, even gum or patches, then it can compromise the quality of your healing. And this is not a surgery that you want to really mess with this. Now, a lot of people ask, do I even need a lift? And if you want your breast to be higher on your chest, then yes, then you could be a candidate to get a lift. There's a pencil test that I've seen online, and people talk about sticking a pencil underneath the breast, and if your breast can hold a pencil, then you need a lift. I don't believe in that. I think that if you want the appearance of your breast to look lifted, then we can talk about a lift. Just because you can hold a pencil or a crayon or, whatever, your shoe under your breast, it doesn't mean that you have to get a procedure or not. So there are definitely advantages and disadvantages. That's one of the big questions that we get from our patients. Do I need a lift? Do I need an augmentation? Or do I need both? So mastopexy only. So just lifting the breast, no implants, just lifting it up. It's great for people who want to have their breasts lifted up higher. So one of the ways that we judge if this is going to be what you want to have done is by grading your ptosis. Ptosis means droop. So the droop of your breast depends on two main things. It depends on your nipple areolar complex and also your inframammary fold. The inframammary fold is that area underneath the breast, so where it meets the chest wall. So it goes from right here to here. So we look at your nipple areolar complex, and if it's above the IMF, then that's grade 0. If it's at the IMF, it's grade 1. If it's below the IMF, it's grade 2. If the nipples are pointing at the ground, that's a grade 3. There's also something called pseudotosis or fake ptosis. That's when the nipple is in the right position, but there's a lot of extra breast tissue and gland that's below it. So it gives it the appearance of being droopy, even though the nipple's in the right place. I don't see it a lot in people who haven't had surgery. What I usually see it in is when people have had a previous augmentation mastopexy. It's usually with that, where the implant bottoms out, and so there's a lot of breast at the bottom, but the nipple's in the right place. And this matters because depending on the grade of ptosis or what is going on in previous surgeries, we determine what type of surgery that you'll get. So the advantage of getting the breast lift is that your breast is lifted. Without an implant, you don't have to worry about an implant, and in bathing suits, without a bra, in regular shirts and other things, you're not going to be so dependent on a push-up bra to get the look that you want. The disadvantage of a mastopexy is it does not fill up the upper pole of the breast over here. It will make it a little bit better, but it's not going to be the same effect as if you got an implant. So one of the ways that you can see whether or not that look of the breast lift is what you want to get is, well, first of all, look at the pictures online on our website. But the other thing you can do is if you take your arm and just hold your breast up like this. Don't push it up, just hold it up right here. It will show you what your breast is going to look like. It adds a little bit on here just because the breast is not pulling it down, but it's not going to give it a push-up bra look.
Yeah. So if you want more volume in the breast overall, or more cleavage in the upper pole, more volume in the upper pole, that's when we talk about doing an augmentation at the same time as a lift. Some surgeons may do it in stages, do a lift first and an augmentation later. We do it typically at the same time. We do it's called a one-stage mastopexy augmentation, where we're doing the lift and placing a breast implant or doing fat grafting, depending on what the patient wants. Now, these are not large implants. In fact, we're limited on how large we can go with the implants because of the breast lift. If you go too large, then you can risk problems healing your wounds and complications with infections and that sort of thing. So we're really, when we're doing a mastopexy augmentation, we're not doing huge volume enhancement. It's a little bit of enhancement to the upper pole of the breast there, whether it's through a saline implant or silicone implant or fat grafting. And you can check out our other video on breast augmentation to get more details on what a breast augmentation is. There is a myth out there that a breast implant alone will give you a lift. Well, that's true to an extent. So the larger the implant or the more projection the implant has, yes, it will lift your breast up a little bit, but that's very limited. So if you really need a breast lift, then an augmentation alone is not going to do the trick. You're going to be much more happy with a breast lift and an augmentation or just a breast lift alone. So you consult with either Dr. Shah or myself, and we can determine what is really best for you.
There are three main types of incisions that we use for mastopexies. The first one is called a donut lift, and or it's also known as a periareolar lift. And we don't really use those. The reason why is there's a lot of disadvantages to it. First of all, it only is great for a few centimeters, like maybe 1 or 2 centimeters. So when we're using it, we are only really just maybe getting the nipples a little bit more aligned. The reason for this is that when you're taking a breast and trying to lift it through an incision that's only around the areola, what often happens is a lot of stretching of the areola and also pore scars. We've had lots of people come in from other places for a revision, and we see this expansion of the areola and pore scarring. So we don't really do that if you actually need a lift. The main two incisions are the lollipop incision and the anchor incision. So the lollipop incision has an incision around the areola and then going up and down the breast. And this is great for somebody who needs a little bit of a lift, but doesn't have a lot of excess skin between the IMF and the nipple. So this is a good option for them. Sometimes we can combine it with some liposuction. The other one is the anchor lift, and this is the one that most people, when they're thinking about a significant breast lift, this is the incision that you get. So there's 3 main incisions. One goes around the areola, one goes down, up and down the breast, and one goes underneath the breast. And
it's demonstrating. Yeah.
So of those 3 incisions, the ones that are visible when you look in the mirror are going to be the ones that are around the areola and the one that goes up and down the breast. Fortunately, these are the 2 of the 3 that heal the best. Usually the lines that are from these incisions, they heal as a nice fine white line, and they're not very noticeable. The incision that goes underneath the breast, it's more of a visible incision if you're looking directly at it. However, fortunately, it is hidden underneath the breast because there's always going to be a little bit of overlap of the breast with that area. So most people don't see that incision at all.
Yeah. And I think it's important, to consult with one of us to decide which of those incision patterns is best for you. So, really, the lollipop versus the anchor one, it's meant for certain kinds of people and certain kinds of ptosis. So we want to make sure that you have the breast results, and consulting with one of us to decide which incision pattern is best. It would be right for you. So the important thing that a lot of patients want to know is what's the recovery like after a breast lift or even a breast lift with an implant. So typically for most of our breast surgeries, we want you to refrain from strenuous activity for about 4 to 6 weeks. So that's no strenuous exercise or activity around the house, heavy lifting, especially above your head, nothing more than 15 pounds for about 4 to 6 weeks. And we want to make sure that you're not putting any stress on your incisions, especially if you have an implant adding extra weight. We want to make sure that you heal properly and you have no complications. So just refraining from that strenuous activity, you can still do normal stuff around the house. You can do light exercise. And then after 4 to 6 weeks, if you've healed really well, then of course you can go back to doing normal activity after that. So, that's breast lift in a nutshell. This is how we do it. I hope you enjoyed the video. Stay tuned for the next one.
See you soon.
See you soon.